My name, most people know me, is Julieta Hernandez. I am an assistant professor at the Mailman Center. And welcome to the ground rounds of today. Let's see the title there on the screen, A Taste of Trauma-Related and Evidence-Based Resources for Latin American Communities. And we're very fortunate to have as presenters Andrea Ocampo, and she is the Service Systems Program Coordinator at the National Center for Child Traumatic Stress, part of the Trauma and Resilience Project at the University of California in LA. And then Luis Flores, and he is the Executive Vice President of Serving Children and Adults in Need, the SCAN program from Laredo, Texas. And then finally, we have Rocio Chang Angulo, and she's a clinical psychologist and assistant professor at the Department of Psychiatry at the University of Connecticut Health from Storrs, Connecticut. Thank you for presenting today, and let's start.
Thank you, Julieta, and we are happy to be here. So we are going to talk a little bit today about the three of us, we belong to the National Child Traumatic Stress Network. So we're going to talk a little bit about what is that network, the structure, and the efforts to address childhood trauma from the network and also from each of our organizations. And we will highlight some efforts, especially to focus on the Latino population. So the National Child Traumatic Stress Network, and from now on, we will call it the network for easy access, was created by Congress in 2000 as part of the Children's Health Act in recognition of the prevalence and seriousness and lifelong consequence of childhood trauma. So the network mission is to raise the standard of care and increase access to services for children and families who experience or witness traumatic events. So this is a unique network of frontline providers, family members, researchers, and national partners that is committed of changing the life of children and by improving the care and moving scientific gains quickly into practice across United States. So the network is administered by the Substance Abuse and Mental Health Services Administration, SAMHSA, and is led by and coordinated by the National Center for Child Traumatic Stress. For now on, we'll call it the National Center. So the network has grown from 17 sites funded in 2001 to 116 currently funded centers, 170 affiliate centers and individuals in 43 states and the District of Columbia. So you can see the breadth of the network there, the blue states mainly. And then we're going to talk a little bit about the structure of the network because there are several interlocking pieces that create the structure of the network, and all these pieces have different yet equal role to support the network. And these different entities really interlock to create the collectivity and the work that we do together. So we have the Category 1 Center, and we'll go in detail on each of these ones. The Category 2 centers, the Category 3 centers, the affiliate members, and the family and youth partners, and SAMHSA. So the family and youth partners are really at the centers of everything that we do. We have to remember that the experience of trauma takes away choice and control. So a trauma-informed healing environment is one that maximizes opportunities for choice and control. So when we put the youth and family partners at the center, we give them control, we give them that voice and choice and empowerment. That is one of the key six principles of trauma-informed care. So youth and families are partnered with network members. They make sure that we are consistent with these principles, and they also participate in leadership activities. Then we have the category one center, which is the National Center for Child Traumatic Stress. That is a partner between UCLA, University of California, Los Angeles, and Duke University. And the National Center leads and coordinates and provides technical assistance to the network. It's a multi-layer organizational and national infrastructure that is designed to meet the increasingly and complex needs of the network. And then we have the CAT2s or Category 2 centers. Those are treatment and services adaptation centers that provide national expertise on a specific types of trauma, the specific population and service systems, and support specialized adaptations of effective treatment and services approaches for community across the country. So right now we have 39 Category 2 centers as part of the network, and when we think about CATUS, you can think about universities, hospitals, large organizations, evidence-based treatment or practices developers, assessment developers, training developers, adaptations of their interventions. So we will talk briefly about two Category 2 centers. Rocio will talk about the Center of Treatment of Developmental Trauma Disorder at UConn Health, and I will talk briefly about the Pediatric Approach to Trauma and Resilience. Those are two category centers, and we'll talk about a little bit about the work we do and highlights the particular efforts for the Latino population. And then we have the Category 3 centers, and those are community treatment and service centers. So those are the ones that are providing the direct services and training on trauma-informed practices to child service systems, right? So we have 76 centers right now as part of the network, and they provide community education and prevention and treatment. So when we think about CAT3s, you can think about community-based hospitals and universities, child advocacy centers, community mental health, schools, child welfare, juvenile justice, residential, among others. And Luis is going to talk about SCAN and the work he does there, and that's a CAT3 center as part of the network. Then we have the affiliates. So we are not a membership organization. We are a network of sites that apply for a grant. And affiliates are those that were formally funded. It could be at the individual or organizational level, and they continue to be part of the network. They will continue to be connect, and they get the benefit of the collaborative work, continue to contribute to advance the field, and right now we have 160 plus affiliate members. They can be, part of leadership roles, participate in everything of the collaborative activities that we have in the network. And then last but not least is SAMHSA as part of our structure, and that's the funder. And of course, they monitor data, and all the sites that are part of the network, they have to submit reports for accountability. So the network has a nature of collaboration, right? And has a collaborative framework, and where we think that our combined effect is greater than the sum of our individual efforts. The network provides these learning and collaborative opportunities to build connection, to be integrated in this big collaboration among sites, and the network is built on the foundation of connection and collaboration. And these are a few examples of how network members can collaborate and learn. We have the learning center, and that's the address. And it's full of resources and podcasts and webinars and training guides about on different training curriculums, and that of different type of trauma that target different populations. We also have the collaborative groups, and we'll talk a little bit more about that. We have network initiatives, and we'll talk about 2 initiatives. And members can also take into leadership positions, like be part of the steering committee, participate in conference, or other connections activities that we have, like NCTSN Connect. So one of the main vertebrates of the network are the collaborative groups. We have many collaborative groups, and network members can participate in different collaborative groups according to their expertise and also according to their interests. We have collaborative groups that are focused on service systems. So we have the school collaborative group, we have the child welfare, we have the juvenile justice collaborative group, we have collaborative groups focus on lived experience and expertise, like the Youth Task Force. We have collaborative groups that focus on types of trauma, like sexual abuse, like traumatic grief. We have a collaborative group focused on secondary traumatic stress. And we have the Culture Consortium that really focus on everything that is really that intersection of trauma and culture, and more recently in last couple of years focus on anti-racist initiatives. And then we have the populations, and that could be the refugee, the 0 to 3, and the most recently formed the Latin America Children and Family Collaborative Group that Luis is going to talk a little bit about it, and I think Rocio too. That focus on the Latino children and families. And really this was a need. A recent survey from the network reflects that high percentage of network sites serve Latinos and also provide bilingual services and have a high percentage of bilingual staff. So really, and as we know, Latino youth experience potentially traumatic events at significantly higher rates than their peers. So there was really a need for child service providers, professionals, to expand their knowledge and skills to serve this population. So I wanted to highlight to you the COVID initiative and the COVID-19 response of the network, because really the network coordinated a variety of efforts in regard of COVID-19, specifically assessing the pandemic and how it impacted the network and the providers and the programs and services, and also, of course, the children and family that we serve. We organize a response to the pandemic to bolster members' continue provision of the vital trauma treatment resources and to children and families throughout United States. And we identify the unmet needs and populations at high risk, and providing trauma and grief informed frameworks to meet the current and emerging needs during this pandemic. The other initiative that we have is the anti-racist initiative, and this initiative is an opportunity for network members to learn more about anti-racist, to catalyze change at the individual level and at the organizational level. And we know that the current pandemic has highlighted the need to address health and educational disparities based on race, ethnicity, income, immigration status, and other factors. So the network has focused on that. And also there, I just wanted to mention, we have also a supplement. We had a supplement for unaccompanied children, and there were so many sites serving this population. You have the numbers there that were really impacted with the supplement, helping with this crisis. Okay, so this is a little bit about the network. Now I'm gonna go super fast, just an example of a cat too, because we will have another one. So I'm also part of this category 2. So I work in the National Center, helping coordinate the network, and I also work at the pediatric approach to trauma treatment and resilience. So this is a novel and successful way to train pediatricians to recognize and respond to trauma. Pediatric medical providers are likely to be the first and sometimes the only professionals with the opportunity to assess the myriad of symptoms demonstrated by children experiencing trauma. For many children, the issue that brings them to pediatric attention are trauma related. For instance, 68% of the children seen in a pediatric healthcare setting have experienced exposure to traumatic events, and 90% of the children in urban pediatric clinics have had traumatic exposure. And yet, there are not benefiting for the early recognition of trauma and interventions because pediatricians miss the symptoms of trauma. So the PATTER team, that's the acronym for this project, developed a 2-level training, trauma aware level 1, level 2 trauma responsive, to really catalyze a cultural change in pediatrics so that pediatricians will approach patient care through a developmental trauma resilience framework. And our goal was to provide training, resources, and tools to transform pediatrics to a trauma-aware, trauma responsive system of care. So understanding the impact of racism on children's health and developmental outcomes is one of the most was one of the our intent in the curriculum, and we the integration of cultural lenses was part of the curriculum, but really the PATTER team, after assessing their curriculum, has noticed that we need to really work more hard on integrating race in the curricular delivery to pediatricians serving predominantly high-risk populations. So we are developing new content thinking about providers from different backgrounds and providers serving Latino populations and also helping, with unaccompanied minors. So now I'm going to pass it to Luis. He's going to talk about the an example of a Cat 3 center and some work we have done with highlighting the Latino children and families.
Hi, again, they already mentioned my name. My name is Luis Flores, and I'm the Executive Vice President of SCAN. And SCAN stands for, you see there, Serving Children and Adults in Need. That's a picture of our main building. And basically, I'm going to talk a little bit about SCAN, but primarily my focus of this few minutes that I'm going to spend with you is going to be how we fit within the network. What do Category 3 centers do? So if you can move to the next slide, please. So just to tell you a little bit, we've been around for a while. We're going to celebrate our 40th year. And we provide quite a bit of services in South Texas. We're in Laredo, Texas. If you know where Laredo is, and right on the Texas-Mexico border. And then we not only provide services in Laredo, which is where we have our main office and where we have most of our programs, but we also cover other counties, South Texas counties. I don't know if you're familiar with the geography, with Eagle Pass, for example, Brownsville, Harlingen, and Zapata, and many others. So then we have little satellite offices. So in our services are primarily divided in 3 major categories. We do have substance use services, and in that it covers everything from early prevention, intervention, and then for young children and adolescents. And then we have treatment. In terms of treatment, we have residential and outpatient services for adults and adolescents. So we have 5 different residential programs. And then we have a number of outpatient services that serve homeless, reentry populations, people, kids in the juvenile justice system, et cetera. So, and that's one of the major areas that we serve. Then we have what we call the survivor services. And that one is included, the grant that we have through SAMHSA to be part of the network. Our project is Border Traumatic Stress Response Center, and we provide that one. That one is part of those survival services. We have a shelter for children that have been removed from their homes because of abuse, and then we have a rape crisis center, and then we have other several programs related to survivor and resilience services, and um, and then, yeah, so was prevention, treatment, and then survival services, the three major areas. So we have like about 200 employees. When we started, we were about 16 employees, and now we grew to 200 employees. And then we provide services to over 10,000 individuals every year. And of course, if you know South Texas, you know that in Laredo, particularly, our population is about 95% Mexican American, most of them bilingual, and a large portion of them came from Mexico that are immigrants, or sometimes they're in the country illegally. Next slide, please. So that's just the area that we cover. I mean, just to give you a visual, and the big circle is where our main office is, but those are the satellite offices. In terms of residential programs, we cover a wider number of counties because people refer clients to residential programs. Next slide, please. So how we became a Category 3 center. So then we applied for a grant in 2005, and we're lucky to get it funded. And it was pretty confusing when we came into the network the first time because it's a really complex network. And not only all the different categories that you heard, but also the work that we do, the initiative that we do, how organic it is, the interactions and the collaborations that are developed and that are channeled through the different work groups that are formed. So imagine you walking into the network and you see all these different people, you see the top experts in the field, and then you also see these opportunities for collaboration and something. So it is extremely exciting. Once that you're familiar with the network and know that all the resources that you can tap into. So it really helped us transform the way we do things. Definitely understanding our clients more from a trauma-informed perspective. So that challenged us because it's not only this program that we have about 30 programs. So how we permeate trauma information and all the programs and services that we have. So part of what we do as level 3 centers, so the level 2 centers primarily are kind of research centers, universities, hospitals, and so forth. We actually are the arms of the network. We reach out to the community and we disseminate evidence-based practices, and then also all the network products that are developed through collaborative efforts. So then I'm going to talk about that in a little bit. But also, one of the many things that we do, because part of the mission of the network is transform systems of care to become more trauma-informed. So we work with local systems of care to make sure that they understand the impact of trauma, they understand how to develop services that are sensitive to the trauma needs of children and families. So we do a lot of collaborations with CAT2 and CAT3, other CAT3 centers, and then through collaborative groups. And we select those groups that we think fit our mission, because the temptation is to be in a lot of them. So we need careful not to overextend ourselves. So because there's so many different collaborative groups, and I'll mention a few of them that we are part of it or have been part of it. Next slide, please. So then, what we wanted to do is build capacity. If you know the border area, you're not familiar, we know that it has a really poor service infrastructure. So that has been our efforts to build capacity. And then how do we at any moment we can tap into the expertise of the network. And that's one of the most wonderful things that we experience, is that if we have a case that is difficult, we can call anyone in the network, and they can give us the time to consult on one particular case or on anything. And that is one of the great benefits of being in the network. So we have called Judy Cohen, we have called different people, and they really take the time to look at the particular cases that we have. Or we want to consult on something that we're implementing, that we can tap into the resources and the expertise of the network. So some of the evidence-based practices that we were able to disseminate here, that we were lucky to disseminate, is TFCBT, or trauma-focused cognitive behavioral therapy. Also, another one that we adopted is parent-child interaction therapy. We beginning to use child-adult relationship enhancement, which is kind of taken from PCIT. And then working with Rocio, we were able to implement trauma affect regulation guidance for education and therapy with Target. We had a long collaboration with Lisa Suarez from the University of Illinois at Chicago, implementing trauma assistance therapy for substance use. Since we have residential programming for kids that have substance use disorders, a traditional way of dealing with that was to treat the substance use only. So when we were able to have access to resources in the network, when we met Lisa, then we were able to, she developed an adaptation of trauma assistant therapy specifically for substance use, and she helped us tailor it to residential treatment, and we were able to implement this. So we were been working with her for a number of years to make sure that we provide integrated care. So the kids leave the facility, being careful of not, being exposed to triggers that can lead them to substance use. In this particular case, they're also aware of trauma reminders, and then how to deal with and cope with trauma reminders. In terms of the work that we've done at the local level in strengthening caregiving systems, we targeted CPS, and we use Child Welfare Trauma Training Toolkit. When it was barely developed, we kind of one of the pilot areas, one of the areas that the toolkit was piloted. We would also use, in collaboration also with Rocio, with juvenile justice programs, we use the Think Trauma curriculum. In terms of parent and foster care system, we use the parent resource workshop. And all of these products that I'm talking about, they're available to you. All you have to do is look into the network and access them, and you can, it comes with training guides. The whole manual is excellent products developed by NCTSM. And then we also work with the behavioral care providers and the university, because we use the core curriculum of childhood trauma, which basically, instead of providing a lecture on child traumatic stress, it takes one particular case and you present little by little information on that case, and you get the discussion going with them instead of be teaching. So it's kind of uses problem-based learning to help the people that are being trained develop case conceptualization skills, so they can really get to understand the impact of trauma. And then what to do, not only that, because it takes the case from case conceptualization to actually how are you going to help this particular child, and so yeah, throughout the whole as you see the whole case. And then we do a lot of school presentations and to different schools and other organizations, and we always have in mind how can we help support caregiving systems to become more trauma informed. The next slide, please. Next slide. Okay, yeah. So then, yeah, just the trauma lens that we helped us develop. Of course, understanding the impact of trauma, permeating trauma information in the whole organization. Not only focusing on adults that come here for services, but how do we focus on their children, especially when there's a lot of impaired parenting. How to prevent re-traumatization by systems that indirectly they do that. How we did indirectly, re-traumatize people. We thinking that we were doing the right thing because we didn't have other understanding of trauma. And then also taking care of staff, being aware of the impact of secondary traumatization, compassion fatigue, and burnout. And how do we do as an organization to support staff and to take care of their needs? So a great emphasis on self-care. So what are the collaborations with other centers? So we've been part of the Culture Consortium. One of the program directors here is she's a co-chair for the sexual abuse collaborative groups. I've been part of the child welfare work group. And then, of course, I am part of the substance abuse and trauma work group. And then we were able to finally, after so many years, develop the Latin American Families and Children Collaborate Group, Latin American Children and Families Collaborate Group. And I'm going to talk about now about that. Can you, next slide? So how did we become LACFAM? It has a long history. In 2007, I think a year and a half after we got funded, we just got, so a bunch of Latinos talking in some restaurant, and we began just, hanging out and talking. And then that group got larger, and then the discussions that we had early on is, okay, what does the network do to specifically address the needs of Latino families? And at that time, what we saw, one of the greatest need was more resources in Spanish. At that time, we had done a brief on translation, so then kind of that helped us also open the door to organize a little bit. So we began kind of reviewing and translating NCTSM products, and then we began helping the network develop the section in Espanol, in Spanish section. And then officially we became eventually, I think in 2008, part of the NCTSN Culture Consortium. So we were on the consortium for a long time. I don't want to bore you with the whole translation method that we used to do, but we were not professional translators. So what we do is we got a lot of people that learned Spanish in their home country. I'm from Mexico. Rocio's from Peru, Carolina, Andreas from Costa Rica, and so forth. So then we got together, and then we would do an initial translation, and then as a group, we do revisions until we all agreed on a particular translation. So that's kind of the collaborative way that we went into the review and through the translations. And then that was really appreciated by the network. So we did that because that's something that we saw a need, but also we wanted the network to use us as a resource so we can provide consultation in terms of linguistic competence throughout the network. So we can only do translations in Spanish because we're all Latino and Latinas, but we primarily wanted to be a resource for the network in terms of linguistic competence. And next slide, please. So out of this inquietud, out of this desire to increase the awareness of the needs of Latin American families, over the years, we talked about what do we do? Should we do a video? What else can we do besides doing translations? And and we always said that. And I think we got the courage because of recent events. Last year, we got the courage to submit an application to the National Center to become a work group specifically designed to work on meeting the needs of Latin American families. And that would be from how do we pay attention to the cultural needs of families? Are the services need to be designed in a different way? How evidence-based practices are going to be used, etc. So then we were approved, and we continued with the Translation Review Committee. But now we have the Latin American Children and Families work group, and we had a lot of interest at the beginning. When we were talking about it, we were afraid maybe we're not going to have anybody in our initial call, and we had quite a number of people participate, and we have had already, I'm not sure like if it's 5 or 6 meetings. It's a brand new collaborative group, and we have basically what we have done so far. Part of it is besides getting their input, finding out what are the greatest needs, where the work group needs to go, and also having presentations of people that have implemented services with Latin American families. So we had people presented on a program that was designed specifically for Latino families in New York. We also looked at Puerto Rico, services delivered in Puerto Rico, and I think in El Salvador as well. And what are some of the things that they did to ensure that they meet the cultural and linguistic needs of those populations? And then we also have started the discussion on evidence-based practices. Are EBPs suitable for the families that we work with? Or what is the place that these EBPs have in the care of families or an adaptation. What do we mean by an adaptation? How do we go about it? Because, as you know, those of you who work with Latino families, somebody can say, I translated this, and this can be an adaptation. So what do we mean by that? And besides the evidence-based practices, do they need to be encased in something larger? How do we greet people when they come in? What are additional services we do have besides therapy? What are the traditional methods that we can integrate? So those have been part of the discussion. And those are the kind of the future directions that we want to go. Definitely, we're interested in developing products for Latin American families. And so we're going to see how the collaborative work continues and what kind of ideas get generated to eventually do webinars or develop products. So I'm going to pass it on to Rocio. I'm sorry.
Many thanks, Luis and Andrea, and thank you so much, Julieta and Lizzie, for the invitation. We're very happy to share with you our experiences at the network and what have we all been focusing on. As you can see, I think that the network for Latino providers have allowed us to do what we know how to do best. There is a common phrase that we use, la unión hace la fuerza, and definitely the network has opened up the opportunity for Latino providers to unite forces and continue making or attempting to make a difference, not only for our Latino families, but also for all the marginalized communities that we work with. So, as Luis has shared with you already, it takes leadership, and it takes Latinos that, know what the work needs to be done and know how to do it. Luis has been one of the funders, first of the translational subcommittee in 2007 in the network. And, it sort of shows also how much work it takes in order to continue making a difference. Carmen Rosa Noroña, who Julieta contacted her first, she was also another funder, and I hope that you will meet her in one of these other grounds opportunities. And also, Carolina Velasco, who is now in Chile, was part of this funder group. And, La Fund couldn't really be created if it wouldn't have been for the support of Andrea, who is with us today, and she really was a big advocate for us to form as a collaborative group. So this is another way of showing how we are leaving a legacy by sort of continue holding on to our values, and is, with union, we can make a difference. So if we can just go to the next slide, please. So I'm going to, we have talked about trauma, but the network defines trauma or a potentially traumatic event as the experience of exposure to actual or threatening death, serious injury, or sexual violation that can occur to the individual directly. It can be also a person who witnessed any of these events. It can be that you are part of a community, right? You are a community member, or that you are also a provider who day in and day out is actually helping people who are exposed to potentially traumatic events. So, we are in this list. So as a health provider, mental health provider, anybody who is first responder, those are professionals who are more vulnerable to experience a potentially traumatic event, even though it might not be directly your own experience, right? So it can be based in the work that you do. So if we go to the next slide, as Andrea has mentioned already, I think that we are all, obviously, even the network who has the most talented and, experts in the field of trauma. I think that right now, sort of living through the pandemic and living through a syndemic, right? We have been sort of given the opportunity to ponder more about what needs to, what are the areas that we need to be focusing on more, we need to improve. And one of the areas that, we all as a network members have been really bringing more voices together to know that we have not done enough to talk about racial trauma or race-based traumatic stress. And given all the last horrific and sad events that we have all witnessed, I think that this is really important for all of us to focus on these important, consequences and how marginalized communities are suffering as a result of racial trauma or race-based traumatic stress. So when we talk about this, we talk about, it refers to the mental and emotional injury caused by encounters with racial bias and ethnic discrimination, racism, and hate crimes. So any individual that has experienced an emotionally painful, sudden, an uncontrollable racist encounter is at risk of suffering from a race-based traumatic stress injury. And in the US, we all can sort of agree that Black, Indigenous, people of color are directly or indirectly impacted by racial trauma. So if we go to the next slide. So one of the important things is that I am the co-director of the Center for the Treatment of Developmental Trauma Disorders, and I'm so happy that I can share with you what the CTDTD is doing now. So we are a category 2, and what we have been proposing and we have been working very hard over these last almost 5 years since we got the grant is to train any professionals, in particular clinicians, but any other professional who, or paraprofessional who is working directly or indirectly with children and families who are impacted by multiple traumatic events in their lives. So we focus on training clinicians and other staff members into how developmental trauma, complex trauma has impacted the lives of children and also their families. And as a result, also it has impacted their own communities. So we are working, we have the privilege of working with experts in the field of developmental trauma and complex trauma around the nation. And they really help us to present in therapy the most challenging cases. So we call it critical moments. And we actually use films in order to educate our professionals. And the films are actually, conducted by the therapists who are well known in the field for doing this type of work. And we have partnered with many community grassroots organizations who are clients in the film. So this is an innovative and collaborative work between psychologists, a film team, and an ensemble of actors and actresses in the development, execution, and delivery of trauma therapy, focusing on the most challenging and critical moments in sessions. And what, our main focus is mainly is to bring up conversations about many times the isms that our patients, our clients, in addition to all the traumatic events, have to encounter during their lives. So if we go to the next slide, please. So this is actually a photograph of who we partner with. One of our amazing partners is a theater group that is composed by adolescents, and you see the director here Jonathan Gilman, who has been working with adolescents for over 30 years, and he trains them to do improvised theater. And they are the main helpers and supporters for the films that we have developed. And we're gonna see in the next slide another picture, but this time you are not only seeing the actors or actresses, but you also see the participants. And the participants of this improvised theater group that goes around the state of Connecticut, where we are now, but also in other states, these kids, these actors, actresses, bring their own skits to talk about many traumatic events that children, adolescents go through that include racism, discrimination, and sexual abuse, incest. There are many very difficult topics that oftentimes is really hard to talk about, especially with young populations. But they do discuss it in the way that they use theater to discuss these big events. And the audience is actually also welcome to ask any questions that the actors, actresses will answer in character about what they just saw. So this approach we took and we are applying it when we develop the webinars because not only we film therapy sessions, but we also filmed interviews about the therapy session right after this therapy session, where we interview the therapist about what he or she thought about how she or he did, but also the actors or actresses answer in character about how the therapy went. So if we go to the next session, the next slide here. So, when we partner with grassroots organizations, we are partnering with the arts now with this theater group for social change. And, I think that has been a deep privilege of us because, they have been doing the work by themselves for so many years, but us partnering with them has opened up for us more possibilities about how we can really connect with the many things that marginalized communities are being affected by. So I already mentioned our collaborative group. To ensure open and genuine participation of families and children with traumatic experiences, clinicians have been engaging with community members in non-traditional ways to co-develop clinical pieces of training detailing the most critical moments during the sessions. And from this exchange, clinicians, children, and families, we all join forces to process therapeutic interventions together through this docudrama and reality style film production techniques. That this has been really, to me, an amazing way to sort of utilize interdisciplinary professionals in order to have a common goal. So if we go to the next slide. So very briefly, I also going to mention that the University of Connecticut, under the direction of Dr. Julian Ford, who is the PI, the principal investigator for CTDTD, he also was granted another center through the network, another category 2, and is the Center for Trauma Recovery and Juvenile Justice. These centers are funded by 5 years, and it actually reflects, the title reflects of what we do. We provide technical assistance to professionals and paraprofessionals who work directly or indirectly with children and adolescents and young adults who are involved in the criminal justice system. So Luis have provided a very good list of evidence-based models and curriculums that can be found in the network, and they all can be found for free. So you can all have access to it. You only need to register in order to get all the information. And most of the lists that Luis has offered are some of the things that as a category 2, we provide free trainings around the nation, including also Puerto Rico. And these are some of the ways that we try to empower communities by training leaders in their communities to become more trauma informed. It makes a difference, and I think that it makes a difference when we definitely try to partner and understand the needs of each community, because the needs of each community is a little bit different than the other. The last thing that I want to say is that for the Center for Treatment of Developmental Trauma Disorders, we have already more than, I would say, at least 30 webinars that focus on different aspects of the different types of trauma. We also focus on different cultures, families, family structure, many different things. And clinicians, I think, that can obtain an overall therapeutic skills on how to work with different populations, including the Latino communities. And I hope that you have a chance to register and to check us out. We have through the learning website that Andrea showed you at the beginning, you will have access to all the webinars, and they are an hour and 30 minutes long. You will see the interactions during the therapy sessions, the interviews that happen, but also you will hear commentators who are usually experts in the field that will also give you their appreciation and their reflections of what they're seeing in each webinar. So with that, I'm going to stop, and I'm thank you for the opportunity to be with you today. I think that before I stop, I'm just going to try to answer one question. So thank you, Dr. Pulgaron, for asking this question, and it is about any suggestions for working with kids whose parents are not in this country or don't have a consistent caretaker. That has been a consistent challenge for us in working with immigrant youth. And thank you so much for the question. That's a really great question. I will start up with with an attempt to answer it, and I know that my colleagues will also fill in. So I think that when we work with immigrant kids who were actually who face a lot of losses, and many of them face also the unambiguous loss, right? One technique that we use that has been effective is asking the kid to work with us on a life book, and that capturing every sort of interaction that they find that is very positive through this life book, right? Also, giving some language about some emotions that can be considered positive, but also giving a space to the grieving, and giving a space to the difficulties that they are facing as a result of this unambiguous loss. So many times that can be very therapeutic, and obviously the first step is to establish a rapport, to make sure that that you know the limits and the boundaries that this child might have. But then little by little, I think that this can be a good way to begin facing some of the daily sort of challenges that these children might be encountering.
I actually have another question about the videos. The videos sound amazing tools. And you mentioned the webinars that we have access to those. So I am not clear what is the relationship between the webinars and the videos. Are they the same? Are they even related?
Yeah, so the webinars are, the films are in part of the webinars for us, for our center. But you will find tons of other informations in sort of the same thing, webinars, but they do have different contents. We are the Center for Treatment of Developmental Trauma Disorder. We are the only center that I'm aware of that we have done films in order to show clinicians how to sort of work critical moments during therapeutic sessions. And that's what we do. Thank you, Julieta.
Thank you. Thank you. And where do we access these resources? I guess you can put you can put the resources somewhere or in the chat, maybe the web pages or.
Yeah,
go ahead, Andrea.
No, go ahead, Rocio.
Well, I can try to put it in the chat right now.
Okay.
Oh, I have it, Rocio. If you want, I can put it. And I just want to mention, like, so I'm putting the nctsn.org website. That's our main website, and there you're gonna find a lot of resources and fact sheets. We have a robust resources for unaccompanied minors and immigrants, child immigrants, and there also the Learning Center, which is the one specific site that Rocio is talking about, where you can find these videos and these webinars. There you will need to sign up for an account, and then you will have access to all these resources.
Thank you. Thank you. Okay, we're a minute away from the end. Thank you so much for presenting the wonderful work of the network and your respective programs and LAFAM. Thank you for the website there that we can check the resources. And we hope to everybody has a good rest of the day. Thank you so much.
Thank you for the invitation to participate. Thank you, guys.
You're welcome.
Thank you so much.
Bye.
Thank you, everyone.
Thank you, everyone.